Welcome to the online version of the Healthy Heart Support Group for people with heart failure. My name is Sarah Lee Thomas. I have a master's degree in nutrition. I'm a registered dietitian with about 20 years experience, and this was recorded in July of 2011. Sodium and fluid balance. Some people with heart failure have a fluid restriction and some people don't. So there's lots of factors that your doctor will consider when determining whether or not you're going to be on a fluid restriction and how strict that restriction will be. Most commonly, people are put on a 2 liter a day limit. But again, not everybody has a limit. And a few people are actually put on 1.5 liters a day. And that's usually for people that have low sodium levels in their blood. But again, remember, weigh yourself daily. This helps you learn how well your diet and your medications are working to keep you from retaining extra fluid. And remember, this is really critical because when you weigh yourself daily, if there's any sudden changes of like 2 or 3 pounds extra since yesterday, that weight change means extra fluid and your heart has to work harder to deal with it. So that's the other way that you can manage your fluid balance is just weigh yourself every day. But if you do have a fluid restriction that you have to restrict how much goes in, we're now going to talk about how. The first thing to say is, well, what counts as a fluid? The general rule is anything that's liquid or melts at room temperature counts. Beverages, coffee, tea, soda, water, juices, anything like that. Ice, if you have a cup of ice, that will count as half a cup of fluid because it kind of melts down. Ice cream, if you have half a cup, that's like one of those little Dixie cup type things, that amount, or about the size of a baseball, that you count that as about a third of a cup of fluid. If you have a popsicle, a little 3-ounce popsicle, that will melt down and count for about half a cup of fluid. Jello, so that's measured straight across. A cup of Jello equals a cup of fluid. Soups and broths, same thing. Syrup from canned fruits. And gravies and sauces, those are somewhat debatable depending on how they're made. Some gravies won't count, they'll be mostly fat, and some sauces will be mostly fat. So if they're mostly fat, then you don't have to count them as a fluid. But if they're more like a fat-free type thing, then they may count as a fluid. So if you're on this fluid restriction, what are you supposed to do if you feel thirsty? Well, there's several tips that can really help relieve that feeling, that dry mouth feeling and your thirst. So you can chew gum because that helps stimulate you produce more saliva so your mouth doesn't feel as dry. Also just sucking on some sugar-free candies. Caution here, some sugar-free candies will give people diarrhea or loose stools, so don't overdo this one. The sugar-free candies, they're okay up to a point, but if you overdo them, they can cause loose stools. If you kind of have a dry mouth, just sucking on a lemon wedge, a little wedge of lemon, or especially if you freeze it first, that kind of wow makes it really nice and refreshing. Same thing if you like freeze some grapes or some blueberries, so like you wash them off and put them in the freezer, and just sucking on those, it just really helps relieve that dry mouth feeling. And just having a small amount of ice just kind of in your mouth. And just rinsing your mouth out, even if you don't swallow, just rinsing it out with cold water or mouthwash, or even just brushing your teeth can help relieve that feeling of being thirsty. So how can you keep track of your fluids? You have a fluid restriction? Well, one way to do it is to have an empty pitcher that you keep by your sink, and you mark the level of your daily limit with tape on the outside of the pitcher. So you just keep it by your kitchen sink, and every time you have a fluid, you pour equal amount of water into the pitcher. So let's say you had half a cup of Jello. You eat that, and then you put half a cup of water into your pitcher, and you have a cup of coffee. After your cup of coffee, you put a cup of water, go over to the sink, fill a cup of water, and pour that into your pitcher. So as the day goes by, you're adding water to equal the amount that has gone into your body. So you can see, this is how much went into my body, but I can see how much in this pitcher that's by my sink. And so it also helps to think about, spreading it out, not having it all at one time. Just kind of spread it out and save a little for nighttime in case you get thirsty. So this is one way to do it. It's not, you don't have to do it this way, but this is one way that has worked for people. Some people do it the opposite way. They just have their they start with a full jug of water up to their limit, and then they have that as the day goes by, and when it's gone, it's gone. So either way, it's no right or wrong. It's just see what works best for you. Give it a try. One of the most important things that you can do if you learn nothing else, this is the thing to remember, this slide here, is to watch out for rapid weight gain. Because when you rapidly gain weight from one day to another or 1 week to another, that rapid weight gain is not body fat, it's actually fluid weight. So you've gained extra fluid, which means it's harder to walk, harder to breathe, and if you're not careful, that can actually lead you to land in the hospital. So how do you keep an eye on this? How do you prevent that? Every morning, this is what you want to do. Weigh yourself every morning the same way. After going to the bathroom and before drinking or eating anything, and you want to wear pretty much the same clothes. And then you say, did I gain more than 2 or 3 pounds since yesterday? If you did, you need to call your healthcare provider or your nurse. And if you say, okay, today's Tuesday, man, my weight's up 5 pounds since last Tuesday, then you also need to call your healthcare provider or nurse. So if you weigh yourself every morning and keep an eye on your weight, this can help you get help early and avoid more serious problems that could lead to hospitalizations. Here is a summary of the things that you can do to help your heart if you have congestive heart failure. Number 1 is keep track of your weight daily. If your weight goes up 2 or 3 pounds since yesterday, you need to get a hold of your provider or nurse. Get early intervention, early help, and you can avoid more serious problems. Also, if you gained about 5 pounds since last week, so a week ago, that's another reason that you'd want to call and see if they want you to adjust your medicines or do other things or come in. So that's number 1, and it's important to remember. Also, take your medications regularly as prescribed. Believe it or not, if you don't take the medications, they don't do you any good. So that's important. It is hard. You just have to kind of learn what little tricks work for you to remember to take your medications regularly. Also, exercise is recommended by the doctor, so that can help. But you don't want to do something that's not recommended. So it's valuable, but make sure that it's something that your doctor knows that you're doing and is suitable for you and your medical condition. Manage your blood pressure and your blood cholesterol and your blood sugar levels. All of these things affect the health of your heart. If they are high or abnormal, then that can lead to more heart damage, and that makes everything even that much more difficult and the heart failure worse. And so these are things to keep an eye on. Limit alcohol and avoid tobacco, and limit fluids if it's recommended. Remember, not everybody has a limit, but if you are recommended a limit, that's important. And food-wise, limit sodium and make healthy food choices. These can really help you have better outcomes, better quality of life, and feel better.